Asthma is a chronic illness. It affects the lungs. It can affect both adults and children, and it's extremely common. Asthma has many different parts to it. The lungs in the asthmatic patient tend to be very sensitive, very reactive. They react to triggers of different kinds. The airways get very irritated, sometimes get swollen, and the asthmatic patients also tend to produce more mucus than the average person. And all of these things work together to swell the airways and block or obstruct the airflow in the airways, so it sometimes makes it difficult for them to breathe. And when all of these things come together at the same time, that's when the patients get what we know as an asthma attack. So asthma can be triggered by many things. Dust, plant pollen, strong chemicals, any kind of strong scent. If the patient is allergic to any food or any specific medication, an allergic reaction can trigger an asthma attack as well. If they have a cold, it can trigger an asthma attack. So there are many different things that can trigger an asthma attack. The asthmatic patient tends to come in complaining of chest tightness, shortness of breath or difficulty breathing. They're not able to, they feel very uncomfortable. They may have what they call a wheezing sound, which is a very high-pitched sound coming from the lungs, kind of sounding like a hee. And they have a very uncomfortable feeling on the chest. Sometimes they may have significant bouts of coughing where they're unable to stop. So asthma can be treated along two main arms. There is the acute setting, when the patient is actually having an asthma attack, and then there is a long term where we try and control the asthma. In the acute setting, the patients may need to use their controlling inhalers, or if it's severe and their inhalers are not working, then they may need to come to the emergency room where they get nebulizations. The most important part in terms of controlling asthma, though, is the long-term control outside of the hospital, where patients may need to use inhalers every day, or different tablets to control the asthma and to make sure that their asthma they don't get an asthma attack. And this can be done through a clinic or through your private doctor, and you'll get appointments 3, maybe 6 months at a time, and you let your doctor know how your asthma has been going. You can get your prescriptions rewritten, and if you need stronger medications, that can be done. The aim here being to prevent the asthma attack from coming on, prevent the need to come to the emergency room, and most importantly, prevent the need to be admitted to the hospital.